Dr. Nathaniel Garba George. I'm co-founder and CEO of Sun Visage. I'm here to present the chest meter. So massive brain drain in the country of doctors leaving the shores of the nation in search of green pastures has left doctors such as our co-founder, Dr. Ike, to be faced with extremely large doctor-to-patient ratio far above WHO recommendation, while community health workers such as Mal and Umar are forced at the grassroots level to fill in some pretty big shoes. This is happening in the time when there is a high prevalence of respiratory diseases globally. What you see here is the method that has been used for a very long time in assessing the length of chest expansion. The same method has been used by the military in their recruitment exercises. As you can see, this picture was taken as far back as the 1950s here in Nigeria. In the same vein, the symmetry of chest expansion is determined by placing the bear pumps on the chest of a patient while they breathe. And then this is used to determine the progression of lung disease. And this is practiced all over the world. But there's a big problem here. This method is highly subjective, very technical, and requires many years of training, something that is lacking in the average community healthcare worker. The implication of this is that at that grassroots level, which really is the front line of healthcare here in this country, there is a lot of missed early diagnosis at that stage. And so it results in a high burden of disease in the country. So here's what we're doing about it. With the help of MakeLab, iFair, and this beautiful innovator, we have managed to build the first electronic version of the chest meter. This simple device, this simple device simultaneously measures the length and symmetry of chest expansion, so thereby bridging the gap between the inexperience of the community health worker and the doctor, also greatly improving the objectivity of the process and saving significant time. I would have loved to do a live demo, we intended to, but I'll be considerate because of time. But just humor me and assume it works great, and it will catch fire during the live demo. Okay, so experts, both globally and locally, have predicted a rise in demand for respiratory care devices. And this trend is poised to continue for the foreseeable future, especially due to the experience of the global coronavirus pandemic. So we at Sun Visage intend to take advantage of this trend and ride upon that wave. Our business model is centered around the B2G, whereby a number of innovative solutions are piggybacked in a single package deal for the primary development agency. This would then be implemented across over 100,000 PHCs spread across the country, while we continue to push our B2B and B2C for the military, hospitals, as well as fitness centers. This is what our competition profile looks like. So what we really need at that grassroots level is a simple device that fits into the low technical skill requirement and low cost quadrant. And we believe that the chest meter is suitably placed in this position. So our team is made up of vibrant professionals, which we have a combined experience of solving healthcare problems at the grassroots level of over 20 years. We believe that this passionate team is well positioned to take on this challenge. The next step for us after iFair is to produce 20 units of the chest meter before the end of the year for our beta testing. This would then be used to give us additional insights and feedback in preparation for our first major sales cycle of 500 units in 2023. We intend to increase this number in geometric proportions over a series of cycles for 5 years. And we are confident that at the end of 5 years, we have the potential to sell up to 100,000 units. So here's what we're asking for. We are seeking a strategic partner with significant influence and network at the primary healthcare, in the primary healthcare space, who who can help set up meetings for us with the most significant leadership. In addition, we're seeking for a grant of $700,000 to produce the first 20 units and $16,000, or about $8 million, for the investment of the first 500 units. So thank you for listening.